Hey everyone, it's Mary Ann Pizzatola, and from the New York City Organization of Public Service Retirees. We're the organization that sued New York City to stop forcing us into a Medicare Advantage plan and allow us to have a choice whether or not we wanted the Advantage plan or to stay within our traditional Medicare and supplemental plan, which was provided by GHI Senior Care. We have been doing a few of these videos to explain to people exactly some of the problems of a Medicare Advantage plan and things that the unions, labor relations, Renee Campion, Claire Levitt, Robert Lynn, these are the people that put this plan into place and yet never really took into consideration all of the situations that current retirees were experiencing. I don't know if they don't know that these exist, that these problems exist, but I'm going to read you a letter from a retiree that I received to explain to you yet one more issue that pushing current retirees into a Medicare Advantage plan will cause. So here it goes. Hello, Marianne. My name is Vincent Recchio, and I retired from the New York City Department of Corrections after 27 years of service. I just wanted to let my brothers and sister retirees know why my wife and I opted out of the Medicare Advantage Plus plan. The story is about my mother-in-law, Yolanda. She worked as a secretary for City University of New York. She was a widow and retired at age 77. Mom started showing signs of confusion and forgetfulness in her 83rd year. Her two daughters and I provided her whatever home care she needed. On July 6th, we got a call that she was taken to Maimonides Hospital in Brooklyn. She was diagnosed at the hospital with a UTI and advanced Alzheimer's. Mom stayed in the hospital until July 15th of 2015, at which time she was transferred across the street to a skilled nursing facility. She lost her ability to clean, dress, or feed herself and no longer knew who we were. Mom had United Healthcare Medicare Complete coverage. According to the plan, they boast that they will cover everything that Medicare covers plus. Her contract also said that her yearly out-of-pocket limit was $5,200, and if you reach that limit, United Healthcare will pay the full cost of in-network services. On August 15th, 2015, Mom was still in rehab, and I got a call from the network nursing facility social worker. I was told that United Healthcare would not approve the 100 days that Medicare allows. We were told that United Healthcare would pay until August 22nd of 2015, at which time we would have to pay the full $535 per day charge. They suggested that we drop her coverage with United Healthcare and enroll her in straight Medicare. Why would Medicare approve this but not United Healthcare? After trying to get answers and getting the runaround and non-return phone calls from United Healthcare, we just dropped them. She was picked up by Medicare on September 1st, but we had to pay the nursing facility the full daily fee of $535 a day from August 22nd until August 31st. We paid $7,760 out of our own pocket in 2015. And we tried, but never got a penny back from United Healthcare for her out-of-pocket limit. After numerous attempts, we just gave up because when all was said and done, the nursing facility would have taken the money from us anyway. After 100 days in the facility, we were allowed to prepay Mom's funeral with her money, and the nursing facility took the rest along with her retirement account. We were then able to apply for Medicaid. Mom never left the skilled nursing facility, and 4 years later, she passed away from her condition. We got nothing but excuses from her Medicare Advantage plan. My heart goes out to Vincent Recchio and his sisters because I am fully aware of what it is and what it takes and the expense of trying to take care of a parent with a dementia, and not even to go into the stress of having to do that. But this shows a few things, that the Medicare Advantage plans do not cover you the way you think they'll cover you, even through all of their promises. It is a false level of comfort. And just because they have to cover the same topics or segments of care doesn't mean that they have to cover them to the same level as traditional Medicare and your supplemental. Meanwhile, you think you're covered and you're not. And now here you have a situation that is extremely stressful, that his mom isn't able to take care of herself or communicate for herself. And he and his siblings are required to do so under great stress, because I know what that's like as well, to be able to manage her care. And then having to fight an insurance company to pay for those services. All the while you're trying to do your job, work, the stress of your work, wife, husband, children, etc. So this message goes directly to Renee Campion, Claire Levitt from OLR, Harry Nispoli, Michael Mulgrew, Henry Garrido, and all the rest of the unions. You think trying to force a current retiree who has no say in this plan just to save money for the stabilization fund, to save money to apply towards your raises, budget shortfalls, a PICA plan that doesn't affect or benefit a Medicare eligible retiree. You think by advertising to us that this plan, New York City Medicare Advantage Plus plan, is equal or mirrors your language, mirrors GHI senior care, and even adds better perks or pluses, was a benefit to us? We're here to tell you, and we're going to keep telling you. You lied to us, and we're going to keep telling everybody else you lied to us. I implore you to make sure you do not force a current retiree into a Medicare Advantage Plus plan. I don't care how custom it is. Unless you customize it to fix a problem like this, we don't want it. So that's my message today. Allow us to choose whether or not we want to be in a Medicare Advantage Plus plan or a Medicare Advantage plan. Allow us to keep our traditional Medicare and supplemental if that's what we so choose, and honor the agreements that you made to us. That as long as they are under the cap as identified of the HIP HMO cap in Administrative Code 12-126, you will not be charging us a penalty premium by the order of the judge. And not like you're trying to do now, where you're trying to manipulate the HIP HMO rate, which I believe in July of 2021, the HIP rate was $188 and change. And then you decided to peg the rate to the new New York City Medicare Advantage Plus plan and put a cost on it of $7.50. With inflation rising over 7.5% and everything increasing, not even when these plans started in 1947 was the plan $7.50 at a cost. So I see your rate manipulation. We all see it. We see what you're trying to do, and we're not buying it. And we're going to make sure everyone knows what you're doing. Honor your word to current retirees. If you need to learn how to negotiate, I'm sure there's plenty of labor relations specialists that can help the unions understand the best way to do this. Cost savings should not be on the backs of a retiree. And I'm going to say it again. Cost savings should not be on the backs of a current retiree. With that message, thank you for listening. Please stay tuned because we will have more videos on subjects like this coming in the very near future. We have more issues of retirees, very similar to this one, that we want to let you know about, just in case Claire Levitt or Renee Campion or the MLC decides to tell you another sort of tale of lies. We're here to tell you the truth. Unfortunately, someone has to. Thank you.